The Teaching Health Center program supports primary care residency programs to train new primary care physicians and dentists in rural and underserved communities. What's unique about the Teaching Health Center program is that all of these residency programs have to be based out of community-based sites. When somebody trains in a community health center setting or in a rural setting, that they're actually much more likely than to choose to practice in those kinds of settings afterwards. By training people in the settings that they're going to provide care, you're training them to be ready, to be better. So the doctors and the dentists that are trained in a teaching health center, in that kind of community-based environment, they can think about social determinants of health. They can think in a population health way. They can think about the communities. And the kind of training that they get is really the kind of provider that you want to become a primary care provider.
Being a teaching health center, I believe, as a health center leader, has totally transformed the site location where the residents are in training.
The resident program is key. It allows us to see more patients, and because of that, I think that they have a better relationship with our residents and our clinicians within the communities.
Being a resident at a teaching health center for me is all about the patients. Being in that community and serving the patients allows us to elevate ourselves to the highest level of care and serve these patients.
Being placed inside of a community, it's something about that empowers you to want to impact the community. If your goal is to impact a vulnerable community, what better position to be in than inside of that vulnerable community? And that's what a teaching health center does.